Action.
Hello family, this is Faneligence, and today we are looking at neurocognitive disorders or organic mental disorders. So neurocognitive disorders, when you say neuro, we are talking about the brain or the nerves or the neurons. It's related to the brain, and cognitive means thinking ability. Disorders, so disorder is illness or malfunction. So neurocognitive disorders or the organic mental disorders, these are organic mental disorders, which means they are organic, they are not caused by any other thing, but it's you organically, you the body or the individual's body or the brain is misfunctioning. So when you talk of neurocognitive disorders, this is a mental disorder which affects the cognition functioning of the brain, such as attention seeking, perception, speech, or even motor activities. You know, when the brain is being affected, it affects everything. So the brain, since the brain controls all the body parts, any other parts can be affected when the brain is affected. So you have two neurocognitive disorders or organic mental disorders. We have four types of them. So we have four. So today you'll be looking at delirium. So delirium is the malfunctioning of the brain. This is a organic mental disorder which is characterized by malfunction of the brain. When the brain is not functional, we have the one in which the brain cells will be degenerating. That's dementia. We talk about this some other time. So another name, some other terms that we can call delirium, we can call it acute confusional state. When we say someone is in an acute confusional state, that means the person is suffering from what? Delirium. It also can be called as the acute brain disorder. Then we should know this: when delirium is something that is a disorder that is reversible. It's an acute. We have acute and chronic. Chronic means it's a permanent disorder or permanent illness, and it cannot be reversible. It's irreversible. But for delirium, delirium is reversible. So acute confusional stage, which means this confusional stage is what? Acute. That's delirium. It can be reversible. We have acute brain syndrome, same thing. So here acute, it can be reversible, and it's also known as what? Delirium. We have acute brain failure, when the brain fails to function normally, and it's acute. It's what? Delirium. We have acute organic reaction, when the organic matter of the brain is reacting to itself and it's acute. It's what? Delirium. We also have toxic confusion state. This is the confusional state. When you think of confusion, is delirium. It also can be called as the acute organic psychosis. Acute organic psychosis is also what? Delirium. This one irreversible organic psychosis. Now let's look at some causes of delirium. We said delirium is a reversible mental disorder which is characterized by what? Cognitive function or cognitive misfunction. So some causes, it can be caused by organ failure. When an organ in the body is not functioning well in an individual, it can cause delirium. So it can be either the heart, the liver, the lungs. When any organ in the body is not functioning or fails to function. We have medications. When we take medications, it goes to the brain to affect the brain or cause the brain to perform its function. When we take medication that affects the brain functioning, it can be it's caused delirium. That means medications can also cause delirium. Example of medication like psychotic drugs can also cause delirium. We have dehydration, when there is enough loss of water in the body, it can cause delirium. You have the head trauma. So head trauma is when an external factor, external pressure is being exerted on the head or the scalp. The scalp protects the brain. So immediately there is external force of pressure acting on the head, it affects the brain inside, and then a person can go through delirium. We have hypoglycemia. This is an abnormal decrease of what? Blood sugar level. So when glucose is being decreased in the body too low, it can cause delirium. Then we have hypothermia or hyperthermia. Hypo means higher, hypo means lower. So thermia is related to heat or temperature. So hypothermia, high blood high body temperature, and hypothermia, decrease or abnormal decrease body temperature. We have infection, some infections like syphilis or other medical condition that we can characterize. It can also cause what? Malfunctioning of the brain, and it's called what? Delirium. We have intoxication of heavy metals. Some heavy metals like iron, mercury, and other heavy metals can cause delirium. That is the main reason why we are fighting galamsey in Ghana. So because of the heavy metals they use in extracting the gold or the minerals, when it gets into our water streams and we absorb them, it can cause delirium. We have intracranial infection. Intracranial infection, intra means within or inside, cranium, which is the skull or the bone that protects the brain, infection. So intracranial infections such as meningitis and other so all the infection that affects the brain can cause delirium. We have hypoxia. This is a medical condition in which an organ in the body is not receiving enough oxygen. So when the body is not receiving enough oxygen for survival, it's called hypoxia. And hypoxia is mostly linked to ischemia, because we know it's the blood that supplies the body with oxygen and nutrients. So when there is ischemia is an insufficient supply of blood to an organ. So when blood is not being supplied to an organ for enough oxygen, which is ischemia, it can also cause delirium. You have the post-operative state, after operation or after surgery state. So after surgery, some people go through delirium, which their brain malfunctions or that fails to function normally. You have features of delirium. So when someone is going through delirium or someone is going through the acute confusional state, some features or some characteristics that the person portray. So an individual going through delirium will portray hallucination. Hallucination is when a person is feeling or is outside the reality. So the person is not feeling or accepting or not knowing the presence of some stimulus in his or her environment. So we have the 5 types of hallucination. We have the visual hallucination, when an individual sees things which are not in existence. And we have the tactile hallucination, when an individual feels a touch or feeling on the body or the skin which is not present. We have the olfactory hallucination, when an individual smells something or smells a scent which is not in existence. And then you also have the gustatory hallucination, when an individual tastes or feels like eating something which is not in the buccal cavity. We have the auditory hallucination. This is a type of hallucination in which an individual hears voices which are not in existence. So we also have illusion. Illusion is also a mental disorder which is characterized by misinterpreting of organ. So an individual will see a pen and will see it as a sausage and will start chewing. So that's illusion. Then you have memory loss, when an individual fails to recall or bring out something that has been stored in the brain. So an individual is having a failure in remembering some things or other stuff. It's a memory loss. You have caphology, when an individual breaking or plugging him or herself or clothing, bed sheets or things, either the hair or stuff. There's caphology. You have calling out or moaning. This can also be called muttering. So muttering or calling out or moaning, this is characterized by an individual speaking to him or herself. An individual like meditating, in the form of meditating, speaking to himself, which another person cannot hear. And we have delusion. Delusion is a false belief. When an individual is having a false belief, an individual feels like he or she is an angel, is a president, which is not true. That's delusion. We have apathy. Apathy, I normally say the I don't care behavior. This is when an individual shows non-consent to the environment. When something is happening in the environment, the individual doesn't care. Here is burning. The individual is sitting, watching. That's delusion. That's apathy. You have anxiety. When an individual is anxious or fear, the person is scared of the environment, is alert whether something is happening or the person, that's anxiety. The person is anxious. We have depression. When an individual is depressed, the individual is down, dopamine level is down, the individual is depressed. That's depression. And then an individual with delirium will also show a symptom of dysarthria. Dysarthria is a kind of it's a medical disorder which is characterized by inability of moving the muscles around the mouth to enable the person to speak. So this is difficulty in speaking, dysarthria. The person cannot speak well because the person cannot move the muscles of the mouth fluently or as he or she is supposed to move it. And we know delirium is malfunction of the brain, so meaning the part of the brain that is responsible for speech or movement of muscle has been distorted. We have muscle controllers, the same thing. When an individual is able to control his or her muscles, hold the marker, the individual drops it. An individual drops it. When an individual is to shake hand, the individual has cannot be stable, so the muscles are moving uncontrollably. We also have dysgraphia. Dis, so the prefix dis, whenever I see dis means difficulty. So difficulty, graphia, writing. So dysgraphia is difficulty in writing. This is also characterized by the motor active part of the brain is being affected, so the person cannot control the muscles to write as he or she is supposed to write. So let's move on to the types of delirium. So the types of delirium, we have the substance-induced delirium. Substance-induced, so a substance has been induced. That means it is caused by what? A substance or something that you are taking, either you are abusing drug or something. Under the substance-induced delirium, we have two types of substance-induced delirium. We have the substance intoxication. This is caused by when an individual abuses drugs. So the drugs intoxifies the brain, which causes the malfunction of the brain. And it's also the substance intoxication is also a type of substance-induced delirium, which is the effects that the drug has upon an individual. So when you take a substance and the substance is affecting you, so the substance that you've taken is making you to walk haphazardly, drowsy, dizziness, or you are not functioning well. This is the substance intoxication. And the substance withdrawal is when an individual has abused the drug, has become tolerant or has tolerated the drug to the system. When the person is trying to abstain from the drug, it brings about this withdrawal delirium. The body, because the body has tolerated the substance, the body needs the substance to perform its normal function. So always I take alcohol before I can wash myself, before I can walk, and when I'm not taking the alcohol anymore, my body cannot perform that function on its own. It needs the substance, the alcohol that I've been taking, before I'll perform that function. Now the second one is medical conditioned delirium. This is when an individual has a medical condition such as hypoglycemia or hyperglycemia, syphilis, or any other medical condition which has caused the person's brain to malfunction. We have the medication induced. So the normal medication that we take to cure diseases can also cause delirium, which when you take the medication goes to our brain to cause our brain to function. So for that matter, the medication also causes us delirium, which is the malfunction of the brain. We also have delirium due to multiple etiologies. This is delirium which is caused by 2 or 3 of any of this mentioned above, which is caused by this, that, which has come together to cause the person's brain to malfunction. So looking at the outcome of delirium can be cured faster, since we knew that delirium is an acute confusional state. It's something which is acute. It is reversible, so it can be cured faster. And we know that it is always caused by underlying factor. So whenever the underlying factor which is causing the delirium is solved, delirium is also resolved. Delirium is also worse in elderly people which have the pre-existing dementia. So for them, their brain cells are already degenerating. So when the delirium sets in, it's hard for these ones to overcome it. And also we have hyperactive behavior profile. People with hyperactive behavior profile their outcomes of delirium are worse than those with hyperactive behavior profile. This is because when in hyperactive behavior profile people, they are down, they are already down, they have that calm behavior. So when delirium sets in, it's very hard for them to overcome it. Other than people with hyperactive behavior profile, they are active. So whenever they are recovering, it can be resolved faster. So ladies and gentlemen, this is delirium, or this is neurocognitive disorder, or the organic mental disorder. And today we looked at delirium. This is Funnelligence. Thank you.